medical chairman of the World Taekwondo. I'm so honored to be here with you. First of all, congratulations on your participation in the Paris Olympics. It's my great honor to be with you for Paris Olympics. I will go over medical safety and then also medical services that will be offered for you and also your athletes during the Olympic Games. I have 40 minutes assigned. However, I will try to make it a little bit shorter so that you won't be late for the next session. So as you know, the for coaches, you have your excellent team doctors and team physiotherapists. However, me and the commission doctor and the venue medical the service physicians like OMD, official medical director, will be also involved. And we just want to make sure that we comply to World Taekwondo's the competition rule and then also make everything safe. We are not to regulate your athletes' competition, but we want to make sure that your athletes can compete safely with our medical support. Me and then also official medical director will make a decision if your athletes can fight or like should stop. However, I reassure you that if the injury is nothing emergent or serious, we will do our best to make sure that your athletes can compete after our quick evaluation and treatment. Especially for concussion, please understand that this is something that IOC is always monitoring. So that's why in accordance with the IOC's the concern, we try to be very careful and then also give the best evaluation and assessment to see whether your athletes got concussion or not. However, we will make a decision based on objective criteria. And then also if your athletes needs inspection for taping and brace and then mouse guard, the commission doctor have the responsibility to double check and give advice to referees. And team doctors and team physiotherapists' role is very important, especially before and after the competition and during the break. They can assist, and then also if there's a injury, like the Tokyo Olympics a few years ago, we will make sure to include them in the decision. However, please understand and then make sure the team doctors and team physiotherapists needs to follow our rules, and then we will give separate education just before the Olympic Games. When there's like a medical emergency situation, however, team doctors can assist, but they cannot the lead. So this is one thing that for coaches to make sure with your team doctors. And then if we include team doctors, they can control the bleeding and then also provide quick, the cryotherapy in case that the commission doctor or the center referees allows. If there's a medical emergency again, they can assist, but they cannot lead the medical the team because they don't have a license in the Paris, the France. And we will have enough medical support, so don't worry about the medical services and qualities. And during the game, we will give more information. And this is for health protection. We have the criteria for this disqualification due to medical reasons. This is FYI. I know that everyone will comply to the protection gear rules. So basically, if the protection gear doesn't protect the body part, then it shouldn't be, function as a protection gear, which means that they should find the right protection gear with the appropriate size and with no defect. And this includes the mouse guard. So as you know, we have a mouse guard rule and then also piercing and the brace rules as well. This is for athlete safety, and then also this is for the fair the applied application of the rules for everybody. One thing is that as coach, please make sure to check your athletes if they're still having piercing, earring, or like any kind of the hard material on their body part. If so, please make sure to tell them to take it off before they get into the inspection area, because what we've been experienced is that if they don't remove it before they get into the inspection area, that delays whole flow, and then you can see the emotional conflict, and then this is not good for everybody. So please make sure, either you or your team doctor take care of the piercing earring part, and then also mouse guard before they get in. And we make a decision whether your athletes can safely continue or have to stop based on the competition, criteria. So concussion or something that we have to send the athletes to the emergency room is what we have to make a tough decision. However, again, if this is something that we can still manage during the competition, we'll encourage athletes to come back to the competitions. If there's a fracture and your athletes cannot even stand up or like make a right posture, then that's something that we have to make a decision. Bleeding, we'll make sure to use entire 1 minute plus another 1 minute to stop bleeding. And then if there's a dislocation that we can treat, and then make sure that your athletes can go back to the competition. However, there's some occasion that even like good physicians cannot reduce the dislocation. In that case, we have to stop. However, according to the Paris Olympics, the sports department and the medical director, looks like all the physicians involved in the Paris Olympics are very capable and professional, so don't worry. And then this is a medical emergency situation that we have to send your athletes to the hospital. In Paris, actually, the emergency team is excellent, so you don't need to worry about your athlete's safety. So let's talk about the knockdown procedure. This is what I've discussed with the referee chairman, Mr. Song Chul Kim. So if there's a strong attack to the head or body that causes athletes to exhibit dangerous symptoms such as falling, loss of consciousness, loss of balance, or severe staggering gait, that indicates concussion or mild to moderate brain injury, then center referee shall commence counting. 하나, 둘, and call doctor, doctor, and then continue to count. And until 8, like a yodel, if athletes can continue, the athletes must stand up and then make a ready posture. And then after the referee say 공격, the athletes must show their willingness to continue with the full recovery sign. If not, then unfortunately your athletes will lose, because your athletes doesn't show the willingness of fight, which means that probably your athlete was not recovered. So for coaches, please make sure your athletes stand up and then make a ready posture if they can fight. If they cannot fight, then the referee will stop the contest and then call a doctor, and then doctor will evacuate your athletes. and then the decision cannot be reversed. So the procedure is to make sure that we minimize any fake injury, and then also we want to make sure that we do the right procedure for severely injured athletes. And yeah, if athletes cannot recover by 8, then referee will continue to count 9 and 10 and then stop the competition, as I explained. So basically, this is what I already explained. So here, as you see this video, the referee is calling the medical team after the injury. And this athlete had the severe nose bleeding, which we were able to stop, and we advised to continue. And in this case, we requested 1 more minute to continue. So the athlete got full treatment and was able to continue. And if there's a loss of consciousness and athletes cannot recover, if the athletes recover within 60 seconds, still the competition is ended because it's more than the 10 seconds. And then we will evaluate in the medical room until they recover. So more than 10 seconds of the loss of consciousness not being able to recover means the athletes got concussion. And then if there's any knockdown or knockout situation, our referee will automatically do the video review to make sure what exactly happened before make a final decision. So I know that the pretending injury has decreased significantly for last 5 years, but I just want to give you like a one more request this time to minimize the pretending injury. Sometimes the athletes might try to recover. However, anything like this can confuse entire the judges and our decision, and then this is not good for the fair sports. And if your athletes unfortunately had a concussion or severe head trauma that required the evaluation and then even hospital transfer, this is the suspension period. So senior athletes versus junior athletes, this is actually per age criteria. If your athlete is enrolled as a senior, but age was actually 17, then your athletes must follow the junior athlete suspension period, which is 40 days. If it's senior, which means 18 and older, then 30 days. So we make a decision of the concussion based on one of these 3. So actually SCAT 6 just released a few months ago, similar to SCAT 5, but this part we will do that at the medical room, and then you don't need to worry. And then failure to the recover by count 10 or 10 seconds, this is automatically regarded as a concussion after severe head trauma, and then showing the signs of the neurological problems such as loss of consciousness or like staggering gait. And then if for some reason the referee requested the physician, the doctor, to come and then evaluate in very vague cases, then if your athletes cannot recover fully by 1 minute of the medical injury time, then this is also regarded as a concussion. And if your athletes had like a severe injury or trauma, and needs to do the medical withdrawal, please find me, and then I will do the assessment, and then I'll write everything. And this is for referees, and then also good to know for coaches too. This is a cardiac arrest case that everyone needs to be aware, and then for referees needs to close the match immediately. So as you see, Hong throw the punch to the chest, and then this Chung athlete cannot move, and then just collapse. So this is almost 100% cardiac arrest case. No motion and just collapsed. And even without a punch or kick, if the athlete just collapse like this, we have to suspect cardiac arrest, and the referee must stop the match after calling the physician doctors. And unfortunately, this athlete died because there was no the medical support. And rapid CPR and the resuscitation is the key to give chance to athletes survive. And then also this cervical and severe head injury. If there's an axonal force or rotational force to the head, and either fell, cannot stand, or loss of consciousness, we have to be careful with the neck alignment. And there's some cases that either referees or the coaches become very nervous and very, worried about, really anxious about the athletes, and then just come to the mat and then take the headgear off. Please don't do that. Just please let the medical team handle, because there's a risk that it can cause the spinal cord injury if you don't be careful with the management of the cervical spine. And we have to go through all this sequence to make sure that we don't cause any spinal cord injury if there was an actual neck injury. So as I mentioned, we take concussion seriously. I hope your athletes will be very careful not to get the serious the head injury. However, sometimes it's inevitable. Studies shows that good sports mouth guard decrease the rate of concussion significantly. So that's why our World Taekwondo try to promote wearing the right mouth guard. So if your athletes have the proper mouth guard that is like a certain thickness, we make mandatory to make at least 3 millimeter, and then it fits in the teeth. Then your athletes can have lower risk of concussion. This was from Muju 6 years ago. So referee count, and then after counting, stop the match. And then we checked this athletes in the medical room, and then SCAT5 at that time was positive, so concussion. This is very old video, but if we see this staggering gait, definitely concussion. Sometimes some athletes stand up immediately after very severe kick and then make a ready posture, but in 3 seconds, they just fall down. So that may happen. So in that case, the medical team will be standby, and if center referee call again, or we see the athletes collapse, then we will get into the mat. However, if center referee think that the athlete is really ready to fight, because athletes see your eyes, the athletes see your eyes and then make a ready posture after you say 공격, then medical team shouldn't continue evaluation. They have to just get out of the mat as soon as possible. It was obvious, very strong and severe. And then for referees, please make sure where the medical station is located. And then please look at the medical station and then call doctor. Otherwise, medical team might not be able to see or hear what you're calling. And some athletes might develop very severe signs of brain injury. In that case, the referees can stop the competition, close the match, and then we'll need to send to the hospital, such as having seizure after the head injury like this. This is a sign of very severe head trauma. And let's talk about the mouth guard taping and bracing and piercing rule briefly so that we can review this for you. Again, the principle of the mouth guard taping and bracing is to provide athletes with safety protection and injury prevention. And then also, it must not harm the athletes or opponent as well, and should not affect athletes' performance or match result. So that's how we develop this. And if your athletes have more than usual standard way of taping or something that is not commonly seen, in regards to bracing, then they must see the OMD or me before entering the inspection area. They need to get the signature. So please make sure to find me or OMD if your athletes need additional inspection and signature so that it's not going to delay the inspection process. Otherwise, the inspection referee needs to find me, and then I have to go to the inspection area and then do that, and then they can easily delay 2 to 3 minutes. So please make sure. And then mouth guard. This is at least 3 millimeter thickness. And when they make a mouse guard out of 3 millimeter material, actually some part might be a little bit thinner because they bite. So we have this, the calipers at the inspection area. During the Olympics, I will give one to the inspection referee. However, we measure the thickest area, and then if it's like a 3 millimeter or like a higher, then your athlete is good. And make sure it's not something that they use for preventing from grinding at the nighttime or using some orthodontic purpose like Invisalign. Those are not mouth guard. We cannot allow them to continue wearing that, because definitely there's a risk of the severe dental and jaw injury in Taekwondo. And color, limited to white or transparent. And it's always good to tell your athletes to visit their dentist and then make a good mouth guard so that they can bring the best one. If they get the custom mouth guard, they can breathe easy, and then also that gives the best protection. So some athletes might have the dental brace for orthodontic treatment. So athletes with brace, so rule is they must wear full upper mouth guard, and if they have the brace on the lower teeth, they need to cover so that that like a metal part of the brace material is not gonna damage their own lip or the opponent. If they kick on that part, the opponent is not gonna get the injury in the toe. So that's why athletes needs to cover with some material, either double mouth guard or short lower mouth guard or the brace tube. And if your athlete does not have a brace, then they can just wear one full upper mouth guard. So this is actually, as I always mention, either medical staff of your team or your responsibility. So again, for the best flow of the inspection, please make sure they wear the proper mouth guard. And then this is a brace shield. Actually, if they visit their dentist, they can get this material. So if they have hard time to wear the full, two full mouth guard or one full upper and then lower, partial lower, then they can wear the brace shields for the lower part. And then it's much easier, even though that doesn't give the best protection. You see the mouth guard falling off. So he wasn't wear the good mouth guard and had a jaw fracture. Yes, so this is the example of the with or without mouth guard. And then as you see, this lip was totally lacerated with the jaw. And yes. Oh yeah, so if the outer is like white or transparent, that's fine. Yeah. Um, for review, I will briefly go over taping and bracing rules. So just for prevention or support, please put just maximum of 2 layers, which is 1 millimeter. If your athlete has some sort of like an injury, like a sprain, or some sort of like the ligament laxity, then up to 4 layer, which is 2 millimeter, is allowed. And then they shouldn't cover the knuckle area. If your athletes use some material such as elastics or elasticone that has a rough surface, they need to cover that material with 1 or 2 layers of white athletic tape so that we can sign it on top of it, make sure that it's sealed. And taping color is limited to white or beige. And sometimes some athletes may require putting thin silicone padding around the knee or elbow, as long as that's less than ½ inch thickness, which is about 1.25 centimeter. And when we push, it's very soft, then we can allow. But if it's like this thick, we cannot allow because that gives like too much protection and then too bulky. And then so taping here, as you see, your athlete shouldn't cover the knuckle. And then for brace, your athletes are not allowed to use the hard surface like a metal or plastics for opponent's safety. Just like, this soft neoprene elastic brace is allowed. And sometimes on the foot, if your athletes want to put the padding because of bruise, they can put either the soft spongy material up to 1/4 inch or 0.62 centimeter. Or if you have gauze, you can put 3 layers of gauze. And then just put white tape around it. So this first 3 are like not allowed because yeah, it either covered the knuckle or it wasn't properly wrapped with the white tape. And then on the right side, these were allowed because they had some thumb or finger injury, did not cover the tip of the finger. So one thing that you need to make sure with your athletes for coaches is that the fingertip must be exposed. If there's a real like finger injury and need some tape in the distal finger part, you can cover up to half of the finger here, but this tip part shouldn't have any tape material because there's a possibility that the taping material can injure opponents' the eyes or something like that. So we want to make sure either tip of the toe or tip of the finger shouldn't be covered by the taping material. So as long as half of the fingernail or toenails are not covered and exposed, then that's okay. And this is the example of the foot taping that are allowed. It didn't cover the foot knuckle area. And bracing, yeah, we already talked about it. And then that one on the right side, it has a little bit of silicone padding. Again, it's very thin, so it was allowed it. But I remember some team brought like a very thick the material, and we had to decline that. So padding here, as you see, that lower part is almost covering the toe area, so it wasn't allowed it. And then the next one, that's covering the toe knuckle area, the foot knuckle area, so that was not allowed it. So any part that could be sensitive to the PSS, yeah, shouldn't be covered too thick. And then, yeah, again, no piercing is allowed. We sometimes see this horrible injury. And then I'll briefly talk about the Paris Olympic Games medical services. Dr. Philip Levan, who's the chief medical officer of the Paris Olympics, kindly shared this information with me. They have like a really good top-notch medical service that you don't need to worry, especially for athletes and the Olympic stakeholders. You have access to the medical services. So yeah, you should have medical insurance for the Olympic Games. So you are fully covered period between July 12th and August 13th. And if it's in the French territory, you will be covered. And then this is for all accredited guests for IOC, IF, and NOCs. And medical expenses, if this is a brand new injury or illness or exacerbation of your existing problem, then it's covered. But if this is for something that you already had and then it's a chronic, stable, it might not be covered. The French medical service is excellent. They have a SAMU system for emergency. If you call the SAMU number, they will come to you. And then if it's during the game, our emergency medicine director will call the emergency services and then use their ambulance. During our Taekwondo games in our venue, there will be venue medical manager who's an emergency specialist, and then also ambulance team leader and sports medical managers. And then I will be also involved. And there will be 2 sports doctors, 1 emergency doctors, and nurse, and then paramedics. And all the training venues, including Taekwondo venue, has like a full medical services available. And we'll decide whether you need to be transferred to the polyclinic or hospital, or you can get the service at the venue without going anywhere. So there are so many different medical services available, including physiotherapy, chiropractic, and also orthotics like insole and splints, and the eye doctors, optometry and ophthalmology. And then also there's a dental service and even mouse guard feeding service available. And then there's a pharmacy and then all different kind of medical services. So this is like what they offer. You can see the opening hours, emergency 24 hours, and then all other like services, they open 7 or 8 and then close until like a late evening time. And then, as I mentioned, they even have like one dental technicians that covers every day for mouse guard, manufacturing and fitting as well. And then they have MRI and then ultrasound too. So there are like 3 hospitals. And then for you, they will utilize this hospital beachhead. And then this is not too far away from venue. So from the medical station, to the polyclinic or directly to the hospital. And I will also briefly talk about TUE for coaches. But in Paris, they will utilize this Penthrox for analgesia, which is safe for doping process. And then, let's see. One thing that the IOC, the medical committee emphasized this year was that your athletes probably needs to get the dental screening before they come to the Olympics, because study shows that almost 40% of athletes have some sort of dental problems like dental caries, and that affects your athletes' performance. So if they get the proper treatment before come to the Paris Olympics, they can have the best performance that they can show. And then also, if your athletes bring the digital bite record for the mouse guard, the IOC said the dental clinic at the polyclinic can make the mouse guard for your athletes within a day. So just in case your athletes lose the mouse guard and then there's a defect, they can make a mouse guard at the polyclinic for your athletes. So if they can bring the digital bite, the data or record, then that will be very helpful. And then they have a full mental health service and support. So there's a at least 365 mind zone that has a meditation and relaxation, and then all the therapies available for the psychological support for your athletes. And also they can download this Let's Talk About It app and have a guidance. And I'll briefly go over this doping, anti-doping, and TUE. But please consult your team physician and then make sure they are up to date with the most recent WADA recommendation. So two things that you should know is that any glucocorticoid like steroid is prohibited. So even like a joint injection is prohibited since 2022. And then painkiller tramadol is prohibited as of January 1st this year. So your team doctor cannot bring the tramadol for your athletes, but each venue should have that Penthrox, the material. And then the IV infusion more than 100 millimeter per 12 hours is not allowed except for these circumstances that they went to the hospital and then got the treatment in the hospital or related to surgery. If your team doctor gave this IV infusion, this is not allowed, and then it's like against the anti-doping. And then if even in the clinic we gave it, it's not allowed and may have to go through the TUE. So they emphasize that your team doctor cannot bring needle for like joint injection, muscle injection. This is permitted only if this needle is necessary for their medical conditions, like for athletes with diabetes, they need to get the insulin shot. Then this is allowed, and then this should be reported with the TUE. They said this time they will make sure even during the Olympic Games, if your athletes had a necessary treatment, then they will process this TUE as soon as possible so that your athletes won't have any problem. They said within 24 hours, they can make a decision after your team doctor submit the rapid TUE request during the Olympics. So if it's denied, they will review again if your team doctor requests. However, they said full, the medical record with the supporting documents are really necessary to consider approve the TUE. So make sure if your athletes have any injury or illness, make sure they bring all the medical record so that if needed, they can apply the TUE as soon as possible. And then this is a phone number that you can contact if your athletes needs some sort of like advice or like assistant for TUE. And yeah, this is like one thing. So a lot of times the doctors use triamcinolone for joint injection or like even oral injection. But the washout period, which means that the duration that it stays in the body is too long, 10 days. So if it is necessary, they should use different type of the steroid, such as dexamethasone or betamethasone. Usually washout period is 3 to 5 days with those. And then, yeah, please check with your team physician for your athlete's concern if they need anything. And then this is also the website that you can get more information regarding TUE process during the Olympic Games. Okay, so this is the end of the presentation. Do you have any questions? I know that, yeah, we went through a lot, but what I can reassure is that we will do our best for you and then for your athletes so that your athletes don't need to worry about their health concern. And then we always wish the best for your athletes' success. If you have any question or if you need any kind of documents or resources, please let me know anytime. Yeah, thank you for your attention. Yeah.
So a couple of things. Number one, happy thoughts. Happy thoughts. David presentation is just for all of you to be careful, but in the Olympic Games, hopefully nothing of that will happen. Just David mentioned something very important. We were in the Asia qualification tournament. There was one game, and then the player got kicked in the head. He didn't stagger. He didn't fall on the floor. The referee started to count, but the athlete didn't pay attention to the referee. The athlete was looking for his mouth guard. So as a coach, I know you all know this. It's very important to show that you're willing to fight if the referee is counting. If you don't, you will lose. So I know all of your experience and have experience and professional athletes, but in case you meet other coaches from a smaller countries that's participating in the Olympic Games, please spread the word. You have to pay attention to the referee. It's very important. Now, with no further ado, let me introduce our next presenter, Mr. Corbin Min and his team. Corbin is our Deputy Legal Counsel and also the Integrity Officer for World Taekwondo. So please give him a hand.
Thank you, everyone. So for the integrity session, you guys have had a lot to hear about sports, and this is your wheelhouse. Now we're talking about integrity. As you know, integrity is increasingly important and has been an issue for the Olympic family for a while, and it's becoming more and more of an issue and a priority for WT also. Not because we're having problems now, but because we want to avoid them. IFs that, especially in a very competitive environment where there's a lot at stake, sometimes things like a slight ethical violation or a safeguarding violation or something that may be corruption gets overlooked. Maybe gets oh, we don't have to worry about that. That's not going to be an issue for that. IFs that go too far down that route can have a lot of problems. They even have their status on the Olympic agenda and on the Olympic program at stake. Some of you may remember not that long ago, WT was in that same situation. WT was under a lot of scrutiny for some ethical questions. We overcame that. That's when I joined WT back in 2009. And since that time, we are a world different. Now we have a very strong reputation within the Olympic family. We want to make sure that we retain that strong reputation within the Olympic family. Therefore, as Mito just said, we formed a new global integrity unit. Part of that unit's mandate is to see about monitoring, enforcement, and education for all stakeholders, including the technical officials. All of the IRs in the room would have recently received from the GMS a certification course for PMC. That is prevention of manipulation of competitions. So to give you an idea where we're going with that, by October of next year, all IRs going to WT promoted events will have had to have completed that course. And then by October of the following year, all people receiving credentials at WT promoted events, IRs, teams, officials, will have had to completed that course. And we'll be doing something very similar for safeguarding as well. We also are putting in a mandate to have an integrity officer, a safeguarding officer for CSBs of all WT promoted events and all senior CU events. And for Paris, we will have Miss Nadine Darwani, who is an Olympian from Jordan. She will be the Paris CSB integrity officer. Unfortunately, Nadine cannot join us today, but we do have two members who will be going, Mr. Myungwon Lee and Ms. Claudia Lopez. So Myungwon will be our PMC coordinator, and Claudia will be the safeguarding coordinator in Paris, supporting Nadine. In addition, we're fortunate today to have three members from the IOC's PMC unit and safeguarding unit who will be giving you an orientation. So without further ado, first we will have Ms. Gloria Viceres. Ms. Viceres is an Olympian, and also she is a senior project manager for the IOC safeguarding safe sport unit and the medical and science department. And two speakers from the PMC, Prevention of Manipulation of Competition units, Ms. Laura Vale, and who is the awareness raising officer, and Mr. Aiden Yang, excuse me, the manager of intelligence and investigations. So without further ado.
First, I'm Gloria. I'm speaking today from Shanghai. Well, I just arrived this morning. We are delivering the Olympic qualifier series for the young sports. So I'm very, very happy to be here today. It's a great honor for me. And without any more ado, I will start my presentation. I'm going to go to my presentation now. So I was told to focus primarily on measures for Paris, what we're going to have in Paris for safeguarding and mental health. That's what we, the two topics that encompass our work in Safe Sport. And I'll start presenting first the team. We keep growing. We just had two new colleagues joining the team, the Safe Sport unit. Kirsty is there in the middle, is the head of the department. Scott leads on mental health. I lead on the topic of safeguarding. And then the other colleagues support in different areas in the unit. Let me see. Oops, sorry. So I'm gonna focus on the initiatives, safe sport initiatives that we have in place at Games Time, that now Paris. But first, I'd like to start explaining what we mean by safeguarding. Safeguarding is a word that is a little bit difficult in other languages that is not English. So safeguarding refers to all proactive measures that can be put in place to both prevent and appropriately respond to concerns related to harassment and abuse in sport, while promoting holistic approaches to the athlete's welfare. That's our definition. It's about the athlete as a whole, about their physical, their mental, their emotional well-being, and it is about prioritizing that over results or medals. What do we mean by harassment and abuse? Can you hear me okay?
Gloria, sorry, your slides is up there. Just that I think you need to click the next slide to see. We didn't get to see the slide number 2. All the faces of your team.
Sorry. This one?
Yeah, your PowerPoint presentation. We can see. Yes, it's up there. Just need to while you're presenting all your unit team, we didn't get to see the next slide. Yeah.
Okay, so I'm moving on to the next one.
I think it's better that you stop sharing the screen and you try to share it again, but share the presentation file so we can see the presentation, because just now we can see the file only.
So I'll share again. Can you see it now?
Yes.
Okay. So I'll move on then. Apologies for that. It's a little bit complicated here with the first connections that I'm making in China. But so this will be our initiatives for Paris 2024. Let's see if I can get this to move. Okay. And I was saying our definition for safeguarding or safe sport is sometimes called safe sport. And it's about the promotion of the athlete as a whole, being with their emotions, their physics, and their mental well-being. So, and what do we mean by harassment and abuse? Harassment and abuse. Okay, let's see. It's not really working very well. We have different forms of harassment and abuse, of interpersonal violence. Psychological violence is at the center of all of other forms of violence. Okay, so I'll do that. So we have the psychological violence is usually at the center, and it usually happens before everything else happens. We have the physical violence, for example, in sport. This means forcing an athlete, for example, to compete while injured.
Gloria, I'm really sorry to jump in again. It's happening again. Your slide has stopped from slide number 3. Yeah, can we have your document sent to us, and I'll put it up, and yeah, can say click. Oh yeah, now it's working, but yeah. All right.
So can you see it now?
Yes, for now, yes.
Okay, so
everyone, yeah. The reason is she wants to see her notes, and she's on a full screen.
no, it's okay. I don't need to see the notes. It's okay. I'll send you.
Oh yes, please.
So maybe my colleagues from PMC can present. Maybe it's going better.
That'll be great. Yes, and thank you so much, Gloria.
Okay, apologies. So over to you.
Yes, thank you, Gloria. I hope you can hear me. So this is taking a second. Can you see this properly in the right layout?
Could you do the slideshow if it's okay?
Yes, of
Yes.
course.
And we can see you perfectly. Thank you.
Is it okay like this?
I still see the regular PowerPoint application up there instead of the full screen.
I put in the full screen, but it's still charging on my side. So I guess it's just taking a few seconds.
I see. Okay.
Can you let me know when you see it properly?
Yes, I will do.
Thank you. We have a video in the slide deck, and it seems to be a bit heavy. Is it still not looking good on your side?
Still not yet.
And if I move on to the next, maybe. Is it moving to the next slide at least?
No.
No, how bizarre.
Yeah.
Okay.
Should
It is moving on my side.
share
May I
it through
Wait
my?
if you don't mind,
Yes.
I'll
Okay.
stop sharing. You
yeah.
have
or I could try in the meantime quickly. Should I just
Maybe-
try quickly?
maybe try it then, because it was looking
Yeah.
perfect
share?
on my side, but then
I should-
I'm just gonna share my screen now, and please let me know if you can see as a computer.
Yes,
Presentation.
I can see your screen, Aiden.
Right then, Laura.
Yeah,
I can just
perfect.
move on with the sharing screen and you present if that's all right.
Okay, that works for me. If that works for you.
Yeah, that works for
Okay.
me. Yeah.
Thank you, Aiden. So we found the
No worries.
solution. In the end, I think we hear someone typing very loudly. Sorry, Gloria. I think I muted you. Sorry to be rude.
Perfect. I think that was it. Yeah.
Okay, we're ready to go. Okay, so a pleasure to meet you, everyone from the World Taekwondo community. So my colleague Aiden and myself are part of the IOC's Olympic Movement Unit on the prevention of the manipulation of competitions. So we are here to just remind you a little bit about this phenomenon and what are the rules in place. We assume you know already quite a bit on the topic. If it's not the case, if you have any question or any clarification, just feel free to let us know. Maybe through the chat box or afterwards, we're happy to answer any question by email as well. So before I start, I have a very short video to show you, which summarizes a little bit what competition manipulation looks like across all sports. So if we can move on to the next slide, please, Aiden. Thank you. Maybe we need to turn the volume up. It's not working on your side either, is it?
We can't hear the audio. We can't. It's just the visuals.
That's okay. Maybe we move on to the next slide then. It's not a problem. So basically, I'm gonna repeat a little bit here what the video said, but without the same emotion probably. So you will forgive me hopefully. But what is competition manipulation? We refer to competition manipulation when an athlete cheats on purpose. So this could be either by really losing on purpose a game or a match or a combat, or not doing your best and damaging part of the competition without necessarily impacting its outcome. But it can also be when officials or coaches deliberately make a wrong decision that will affect the competition. The end result, sometimes, but not necessarily. So competition manipulation, you will probably have heard of it in the media as match fixing. So we refer to the same phenomenon, the difference being we use competition manipulation to be inclusive because not all sports are played in matches, like yours, for example. But it refers to the same phenomenon that takes different forms across different sports. Sorry. If we move on to the next slide, we will see why. So why people would fix a game? Why would you do that when you've trained so much and you've worked so hard to be at an event like the Olympic or other international competitions that you are attending? So first, it could be for financial advantage. So you want to make some money, most likely linked to a bet that was placed on the competition. So it could be an athlete, a coach, or an official wanting to fix a game, to fix a combat in order to win the bet that they placed on the money. But it can also be for a sporting advantage. This depends highly on the format of the competition. But depending on your sport and its format, an athlete or coach could be tempted to fix a game so that they face, for example, an easier opponent in the next round. Or in individual sports, for example, it could be that you underperform on purpose as an athlete so that you let a teammate qualify for the Olympics, for example, because you have already qualified and you have nothing less, like you have no risks of losing your qualification anymore. If we move on to next slide, Aidan, we will see who can fix a game. So basically, anyone from inside or outside a competition can be tempted to fix the game, to fix the combats. So being it athletes, coaches, judges and referees, but also external people like agents, managers, just fans or sponsors. And in the worst case, we also see criminals trying to approach the athletes, the judges and referees to fix the competitions. I always want to finish this one slide with a positive note saying, you know, if all these actors might be involved in wanting to fix a game, there are only very limited people that can actually affect the competition. And these are the people who are on the field of play, right? You can be asked by your coach to fix, but in the end, if I'm the athlete, I am the one on the field of play, and I have the power in hand to make the right decision or to make the wrong decision. So these people are only the athletes, the judges, the referees. So you have a very, a strong responsibility here, but also I want to say a power to keep your sport clean from these kind of integrity issues by being informed and knowing what to do in case anything happens. If we move on to the next slide, we can see how a fixer can approach you. This is not to scare you, I would say it's a worst case scenario that is worth knowing about, having seen at least once, so that it turns on the little red light in case you or someone near you is approached this way. But the typical scenario we see happening is someone approaching you, offering, you know, little favors, offering you a coffee, either directly or indirectly through someone from your close circle. This person will try to create a bond with you, to become your friends. And they might flatter you. I'm a big fan of yours. I want to invite you. Here's a little gift for you. But they're very good at identifying your weaknesses, especially now in the era of social media where a lot of information is available. These people will know potentially that you're facing financial issues or any other kind of problem that makes you more vulnerable to an approach of fixing. The first manipulation will often be very small, probably has no impact seemingly on your career, on the outcome of the game, for example. So you think it might be an idea to make a bit of money to get you out of trouble, and after this you stop. The problem is what we see in reality is that the first manipulation is never the last one, and the person in return will ask for more and more and more, and always more serious breaches of the rules on competition manipulation that will eventually catch you in a vicious circle. So we've seen real life situations where people were threatened by the fixers when they wanted to stop, or their families were threatened. So it's never innocent. And again, my message here is just ask yourself, if someone is coming to you with a favor or something, what does this person want in return? Okay. If we move on to the next slide, just to inform you about the possible sanctions when it comes to breaches of the rules on competition manipulation. So both on the sports side and on the criminal sanctions. So on the sports side, it depends on each sport. For the Olympic Games, which is the event we are concerned here in this webinar, there will be a disciplinary group put in place in case of any breaches of the rules. And then the sanctions will also depend on top of that of each sport. So that could be a ban from your sport, from the Olympics, obviously, but it could also be up to a life ban. It can be a fine. And then it's also important to understand that competition manipulation is becoming a criminal offense in a growing number of countries. So in very serious cases, it could end in jail time. So nothing funny at all, but I always say the worst part of it, I think, is the damage you make to yourself and to your family, to your name, with the reputation damage that comes with it. You know, it's just like I want to say a doping offense. Once you have this on your record, it's very difficult to clean your reputation, and that will follow you even after your sporting career. So we'd better avoid that. But now, there's only 4 things you need to know. I'm sure you know them already, so this is a gentle reminder for sure, but there's just 4 things you need to know to keep you safe from this integrity issue that is unfortunately affecting each sport. So this is also something for you to understand. You know, we're often faced with the reaction that competition manipulation only affects football, for example, or basketball. But the truth is, as soon as there is a betting offer on one sport, this sport is potentially a target for fixers, right? And there are bettings placed on Taekwondo competitions. There will be betting offers on Taekwondo competition, as Aiden will confirm for sure. So this comes with a potential risk. That's why these 4 key rules are in place for you to remember what you're allowed to do and what you shouldn't do during your games and in general during your competitions. If we move on to the next slide, we have a short summary of these rules, and then we will be able to dive deep in each of them in more in detail. So don't fix the competition, always do your best. I'm sure this is the most intuitive one. Also, as a judge, as a referee, taking your decision according to the rules and with the highest level of objectivity. A prohibition of betting on your own sport and on any event at the Olympic Games. I will come back on this one into a little bit more detail because this one is a bit more specific. Not sharing inside information. So anything related to your sports that you have as information, as your capacity of judges or referees, we resume it as health issues and sports tactic, but it could be anything related to your sport that is not public information, should be kept confidential. Obviously, because this can be used by fixers to potentially approach someone and try to fix a combat. And then the 4th rule is about speaking up. So there is an IOC integrity line in place. You have the web link on the screen here. So this is available to you during, but also outside of games time. And we really rely on you, on the sports people, to use this hotline to report any breaches of the rules that you might witness. Aiden, if we move on to the next slide, please. So about not fixing, I think we can move on to the next slide. Yeah, there is this very short animation. Yeah, it's not working well like before. It's okay, we can move on to the next. I think this one is very easy to understand for everyone. It's just a short animation we have in place to explain a little bit a case of, you know, fixing and how you could be asked, for example, by a coach to underperform on purpose and fix a game, how you should react as an athlete. Now, the prohibition of sports betting. So I just, before we start explaining this one rule, I think it is important to highlight the fact that this is not, you know, a war against sports betting. We understand there are advantages of sports betting for the Olympics, for the Olympic movement in general. What we're trying to do here is to protect you and to protect the sport from the risks that comes with sports betting for the integrity of sport. This is why these rules are in place as a measure of protection, as a measure of precaution. So you're not allowed to bet on your sport. I'm sure you know this already, but again, it's twice is never too much. So as a judge, as a referee in Taekwondo, you are never allowed to bet on Taekwondo competition, independent of the fact that you are or you are not at the games. And this is valid also for other competitions. So if I am a Swiss Taekwondo referee, I am here in Switzerland, and there's a Taekwondo competition taking place in Korea, I am watching it online, I am not allowed to bet on this, even if I am not taking part. Again, this is due to the fact that I have inside information on the sport, right? So this is one thing. The other aspect of this rule is that you are never allowed to bet on any event at the Olympic Games. So being part of the Olympic Games, being an accredited judge, an accredited referee at the Paris Olympics, you're not allowed to bet on any other sport. This also means, well, I know you are taking part in the end of the games, but let's say, for example, you are still not in Paris and you are watching, for instance, the basketball competition, the Olympic tournament, and you want to place a bet, you're not allowed to because you are an accredited person at the games. Even if you are not yet on site, you're not yet on duty. And this is also valid for any multi-sport event. For example, if you take part in the Asian Games, the same rule will apply. I hope this makes sense. And then about not sharing inside information, I think also, Aidan, we can move on to the next slide if you agree. So this is a little question for you, just to give you a few real life examples. For example, you're a judge referee in Taekwondo. You want to post on your Twitter some details about which round you are involved in for officiating. Of course, this is prohibited. Now we will see an example of something that is okay on the next slide. For example, you post on your Instagram that you're very happy to be at the opening ceremony of the Olympic Games. Of course, there's no wrong with this. This is something you can post. And here we give the example of social media, but this is valid about, any inside information. You're not allowed to share it at press conference. You might be asked by someone, complete stranger or someone closer to you, for this kind of inside information. So the rule obviously doesn't only apply to Facebook, Twitter, and Instagram. Here we have a last one example about an athlete who injured himself competing in Taekwondo, and you want to post this information on your Facebook. So this, as we will see, is not a great idea. Again, if I'm a person who wants to fix the game, if I'm a corrupter, for me, knowing that this person is injured before the competition is a great information to have in hand, because I know this person has little chances of winning, and this person might be, more tempted to be corrupted than another athlete who really goes to win his medal or to give his very best. If we move on to the next slide, Aidan, please, we will, see the last point about reporting. So again, as I mentioned, we do everything we can. Aidan will explain to you afterwards how he monitors the competition, and there is a process in place. From my side, we do education, we do awareness raising, we try to inform the athletes and the judges, the referees and coaches. But there is one part where we really, really need you, is in this reporting bit. This plays a crucial role for us to be able to detect cases. So we always say, if something doesn't look right, it probably isn't. And we're not expecting you to have black on white proofs before you report something, because what you report, and I'm sure, Gloria, the same happens with your topic. Sometimes you are not sure of the value of what you are reporting. Something doesn't feel right, but you're not very sure. But sometimes this little bit of information that you have is one piece of information that comes to complete a bigger puzzle. For example, imagine other 10 or 12 people reporting the same little suspicion, about the same person will obviously trigger a doubt. So to report, you can use the IOC integrity line where you see the link on the screen. You will also easily find it on Google. This is also the hotline Gloria and her team uses for safe sport issues. So I'm sure you will be sharing the same link again. But this is very good. And also you can relate to your World Taekwondo contact person at legal@worldtaekwondo.org for any issue that you suspect. My point here would be for you to make sure you make an official report, right? So speaking about it to someone is not enough, because reporting is an obligation. You need to make sure you have a proof that you fulfill this obligation, that you have this in writing. That's why using the integrity line, I think, is always a good idea and is secured and is confidential as well. Yeah, I think, Aidan, I don't know if at this stage maybe you want to say a few words about, I think it links quite well with the hotline about how we monitor competitions and.
Yes, thanks, Laura. As Laura mentioned, this is really, really important for all of you guys. I'm going to Paris and then officiating in Paris, because we, of course, at the IOC, we monitor all of the sports betting markets and sports betting markets through our monitoring partners and then the members of the EBIS platform, which is our confidential intelligence exchange platform that we have in place for law enforcement agencies and sports betting entities.
Aiden, sorry to interrupt. Could you speak up a little bit? Sorry.
Yeah. What about now? Can you hear me better?
Yes.
Yeah. So for everyone to, in fact, a part of our rule is one of the rules that we have in place in the Olympic movement code on the prevention of manipulation of competition is actually fail to report. And therefore, all of you guys who are on the field of play or part of the Taekwondo community at the Paris Olympic Games are holding some sort of responsibility to report when they are approached by any fixers or anyone trying to bribe to fix matches or something like that. So this is part of your responsibility as part of the Taekwondo community to be able to report any suspicious sort of approaches or actions. And if I could just move on to the next slide. This is once again about our reporting mechanism, IOC integrity and compliance hotline that we have in place. So this is a IT platform where you can enter and then fill out certain information that you can provide to us. Then as the IOC, we are the only one who can access that platform. And what we would do is that we can communicate with any authors who submitted any reports through our reporting mechanism anonymously. So you don't have to disclose your information. So it secures your confidentiality and anonymity. However, we always encourage reporting people to disclose certain information, such as contact information, so that we can further communicate with the authors when we need to, such as receiving further information and or asking further questions for us to be able to collect further information. So once we receive that information, we, of course, perform a very thorough analysis and assessment so whether this information is actually related to certain level of suspicions on the field of play. Then, and once this is determined, then we take the next step, which is investigations. And then based on that, if there were to be a breach of the rules, our rules, then the if this information would be further escalated in order for the IOC to take the next step, which is disciplinary actions and setting up of disciplinary commission to be able to take next step. So I think from our end, before Paris Olympic, we do a lot of activities for the IOC and World Taekwondo to be aware of potential risk at the Olympic Games. So what we do here at the IOC is that first we conduct a risk assessment and we share this information with our contact person at World Taekwondo. So this is in the process of finalization at the moment. So what we actually share is that we share intelligence about potential risks at Paris regarding Taekwondo and sports betting sort of coverage, how many sports betting market would be offered on Taekwondo events. Because if we look at Olympic Games and every single events are offered on sports betting. And we also look at certain further information, like how much money would be sort of placed at Taekwondo, because this is also connected to certain level of risk of competition manipulation or breach of our rules. And of course, we monitor, as I said earlier, we monitor sports betting markets together with our monitoring partners, so that if there were any suspicions detected linked to sports betting, then we can take a further step and then follow up as well. And one more thing that I wanted to emphasize is please, you can come to the IOC reporting mechanism to report any suspicions. And this doesn't mean that you will have any suspicions at Paris, but just in case, please just have the link, just take a picture or something, then you can always have that access with you, and you can always report it to the to us whenever you are approached or you witness any suspicious activities. Yeah, I think that's it on my end.
Thank you, Aiden. And I think that's it on my end as well. Just telling you, we will be on site in Paris with the booth for the athletes in the Olympic Village to inform them one more time about this topic. And again, if any question, feel free to reach out to our team. We're always happy to clarify any doubts you may have on this topic. Thank you very much. And I will pass on to my colleague, Gloria.
Thank you, Laura, and thank you, Aiden. I hope this time it works. Somebody can put up my presentation, please, and I'll start from the beginning. Yes. Apologies if it gets a little bit loud, because I'm here, my colleagues are setting up, so it might get a little bit loud. I'll try to speak louder if it does. Thank you. Okay, there we go. And please put it on presentation mode, would be great.
On screen here, it's on presentation mode, so you can continue to speak, and we'll change it. Go to the next slide.
Okay. Still don't see it in presentation mode, but it doesn't matter. So if you go to the next slide, please, where the team is. So like I was saying, we have safeguarding and mental health under a remit. We are in the medical and scientific department because we have mental health, but also because we like to be and stay very, very close to the science, to the scientific evidence in everything that we do. We're a team of 7, at the moment. We just had 2 new colleagues joining. I still only see the first slide. Sorry.
On our side, we can see all the slides, so maybe you can continue, and then we will keep passing to the next slide as you speak.
Okay, but I don't see my slide presented. It's a little bit difficult.
So sorry to jump in, but I think if you could just exit slide mode and then first do the slide mode and then share your screen that is being with the slide mode. I think then Gloria can also see the presentation in slide mode so that you can everything is in sync.
Also, Gloria, what I did, I had it opened on my own desktop so you can see. You
Okay,
can see it from your end as well.
okay, I'll do that. Well, okay. We're on the side here. Okay, I could continue talking and we'll see how it works with the IT. So safeguarding is about the measures that we can put in place to prevent and respond appropriately to concerns of harassment and abuse, while we are promoting a holistic approach to athletes and official welfare. This means not only the physical, but also the emotional and the mental well-being of the participants in sport. Safeguarding is also a little bit different than other integrity issues. And I know a lot of IFs have it all in one point of entry, and that's under integrity. But safeguarding, some of the other issues are more punitive in nature than safeguarding. And we usually also have a perpetrator, but we also have a victim that we need to take care of. And we need to prioritize the well-being of the victim in these cases. Also, when we manage cases, we need to also ensure that we take into consideration the effects that trauma has on the victim. In terms of, for example, recollection, is a lot of times victims cannot linearly recollect issues or events happening as part of the abuse. So it's really, really important that all the processes are trauma informed. That's what we call it. So that we can provide the best solution, the best support for the victim, while at the same time ensuring that the person accused also has his rights respected. So that's a little bit about safeguarding. We work with a number of different types of violences, interpersonal violences, with psychological violence being at the center of all of the rest. Psychological violence in sport meetings, for example, all the screaming and yelling at children, body shaming, weighing an athlete 3 times a day to see if they have gained or lost 100 grams, all of these things. There is also physical violence, which includes all the punching and kicking and hitting, but also forcing an athlete to compete or train while injured, for example, or subjecting a young child to excessive loads of physical training or physical loads of training. There is also abuse of authority, and this is, for example, intimidation, threats, coercion, right? Or punishing people for speaking up, for example. That's a form of abuse of power. Are you trying to say something to me because I hear some voices in the background, or should I continue?
Yeah, we can hear you. You can continue.
Okay, great. So then there is also neglect, and in sport, this means, for example, not providing the athlete with enough rest and recovery, not providing with enough good nutrition or sufficient water, for example. These are forms of neglect in sport. So again, holistically, it's not only about the most severe forms of abuse, like sexual abuse, but it's about tackling what we call the low-level concerns, And by doing this, we are doing a lot on prevention. We are working really hard on prevention when we challenge all of the low-level concerns, all of the misbehaviors that are promoted in contexts that are toxic and that could harvest a more severe form of abuse in the future. So no tolerance for any form of interpersonal violence, harassment, and abuse. And this is what we're working on, and this is what we're going to be also challenging at the games. So the Olympic, you have there a link to the Olympic Games time framework, which is basically our safeguarding policy for games time. And I will talk about it a little bit more later on in the next couple of slides. For Paris, we have a new program. We have offered NOCs and IFs. For NOCs, we've called it NOC Welfare Officer Accreditations. And they have a very specific role. They are to ensure that the athletes' well-being, their mental and physical well-being is a priority and is properly addressed. They are also in charge of acting as focal points for all matters related to harassment and abuse, and they are the ones to liaise with us when an issue arises during games time. The requirements for these accreditations are that they need to be a nationally certified mental health practitioner or an internationally certified safeguarding officer in sport. And we have just closed the accreditation period. We've had 206 requests. And we will be having more than 150 accredited NOC welfare officers in Paris for NOCs, for 81 NOCs, and 32 international federation focal points, safeguarding focal points, including the two from World Taekwondo that they were being presented earlier on. We also have a chaperone accreditation available for the NOCs for athletes under the age of 16, and this is to take extra care of those most vulnerable, who are the very young athletes competing at the games, and sometimes they need extra support by somebody trusted by them, and this is a possibility that the NOCs can have an extra person, an additional person to take care of them while competing with the big guys and at the Olympic Games. So next slide, please. So the safeguarding framework at games time, it was just updated. It has been in place since Rio de Janeiro, but we've just updated it just before Gangwon, the Youth Olympic Games. It aims at helping safeguard athletes and other participants from harassment and abuse. It includes a very specific set of definitions of all these forms of interpersonal violence and a code of conduct. And it is based on these definitions and this code of conduct that that behaviors will be challenged in Paris, right? From people breaching this code of conduct. There is also a list of educational resources that people can access. And there is a section on the different avenues that we propose people that we have available for people to report concerns of harassment and abuse. And I will talk about it a little bit later on, more in detail. But additionally to the integrity hotline that also my colleagues in PNC use, we have other forms that people can report to us, because safeguarding is a sensitive topic and a lot of people are not so comfortable just reporting online. They prefer the personal touch, so we are also providing a personal
Excuse me, Gloria. Gloria, our apologies, but because of the schedule, we're going to have to move on to the next presentation today. They need to have this meeting room. We will be sharing your presentation slides, if that's okay, with the group. Yeah. Okay. Okay, wonderful, wonderful. And again, our apologies for the technical issues. Okay. And thank you all. Thank you, Gloria. Thank you, Laura. Thank you, Aiden, for joining us today. And we do appreciate your contributions. Thank you. And thank you all for your attention. Again, my apologies for all of the technical issues. We will be sharing with you all of the slide materials. You are just like the Olympic athletes, they are the role models for their community. You are all the role models for your community. So the example you set in the integrity areas are the examples that other people are most likely to follow. So I hope you did take away everything you needed to take from this. We will share with you the materials, and good luck with the rest of the program.
Thank you. Thank you for the presentation.
Thank you.